My name is Dr. Julie Harrigan. My class year is UAG 2003. Oh my, that's a long story. So since I graduated from UAG, I did a year of internship here in Mexico and decided that I wanted to see a different perspective of medicine. So I went to the United States in 2003, just after my year of Servicio Social, and I just went for it. I started studying for my USMLEs independently, got into residency. Took a while though. I think we were discussing this last night. The translation between English and Spanish was a very difficult journey, initially, but, just perseverance. I got into the family medicine program at University of New Mexico Hospitals and became a hospitalist, not very expectedly, but it was, part of, just kind of the part of the journey at the time. You always have ideals of what you're going to become as a physician, and that's what I ended up being. I became a hospitalist in 2009, and started really, delving into patient care, delving into the electronic health record systems. And by 2010, I had lots of opinions about how I wanted, work to go, how I wanted patient flow to go, how I wanted, to improve not only my efficiency, but the efficiency of my colleagues and really patient safety and improve quality of care. And I got into electronic health records just by happenstance. Again, just by being, probably a little bit overly opinionated at the time, and started my career in, medical administration. I started joining medical executive committees, and they invited me to be a consultant, ultimately, probably later that year. And it rolled into implementing electronic health record systems, building them from the ground up, starting the physician order entry systems I think I started with a 12 hospital system at the time, and it developed into a 30 hospital system over the next, several years. And then I became chief medical informatics officer of a very large 30 hospital healthcare system by 2018. And then just kept rolling from there. I've implemented over 75 hospital healthcare systems, electronic health records, then the chief officer for standardization, for quality care, for regulatory policy and compliance. And it's been an amazing journey. I still take care of patients in my spare time. Right now, actually, I'm in between contracts because I became an independent consultant a couple of years ago, and just decided to go back to patient care for a little while. It's really my passion. It's really what I love. I really love just being hands-on. I love the touch and the feel and how it feels to really have an effect on people's lives. And so that's kind of been my journey up to about a week ago. University of New Mexico. My parents, I'm from Arizona originally. So my parents lived part-time in Mexico, part-time in Arizona. I grew up in Sonora. And so it was just a really, easy transition. It was a state that was very close, and they're very friendly to international foreign medical graduates as well. So that was something that really pushed me. And then I met my husband at the time, and fell madly in love, and he was from Albuquerque, so it just made sense that I stay there. And it's been a lovely career there. It's a very beautiful place to live. Oh wow, the UAG really gives you all of the building blocks that you need to be an amazing physician. It's not only the curriculum. The teachers are very inspirational. They're really wonderful. The faculty is fantastic. But what they really impart into you is how to take care of patients. There's so much hands-on, not only in the curriculum, but in the practice that you do, in your rotations, in your hospital rotations, that you have really no choice but to take care of patients. And more than any other school that I have encountered, in and out of the United States, that's really the driving reason behind what they do here at UAG. And I really think that's how the students have come out just so prepared, to really take care of people. And that's really been the most valuable lesson that I learned at UAG is, you take care of your patients. You're ever present with them. You're not, blowing into a mannequin or practicing your CPR. You're actually touching and feeling people. And I think that's really a very, very valuable lesson that sometimes as doctors we forget, because we're learning the theory of things, but we're not learning the people of things. And I think it makes you a much better human. So I am a family medicine hospitalist. I love being a hospitalist. I didn't set out to be a family medicine doctor. Really, it wasn't my first choice. Being an international U.S. born medical graduate is, there's a lot of hurdles to it. You're not always accepted by residency programs. There's not a lot of residency programs around the United States that are very friendly to graduates sometimes. So it was really a choice that I had to make for myself, but it turned out to be the most wonderful thing ever, and the thought behind that was, if I get my foot in the door, if I get into residency, then I can, really take my path anywhere. And that's exactly what I ended up doing. So, I went from family medicine, which I actually don't practice very much. I'm, mostly do internal medicine in the hospital, but I have this flexibility to do obstetrics, to do family medicine, to do pediatrics, to do hospice and palliative care, which is what I also do part-time as medical director. And, and then I got into clinical informatics and, the career is family medicine because you're such a generalist. You have to know everything. You have to know all of these specialties. And it really led me down this wonderful path. So again, not my first choice, but it was honestly the best choice ultimately. And it's led me to so many amazing things in my life. Oh my gosh, tremendously. Being able to do, again, I really think the clinical rotations, it really comes down to that. Really going into the hospital systems and see how they operate. Doing my year of social service was invaluable to really understand the populations, especially the very underserved populations in Mexico, and how the government, really deals and works with them to improve their health, to improve public safety, to improve public health, combat malnutrition, vaccination campaigns, things that we don't really do well in the United States because everything comes very easy to us. The other side of medicine that I think was, really puts things into perspective is the cost of care. The cost of care in the United States it's so relative and it's so inflated and it's, driven by payers and insurance companies and everything. And here, in Mexico, in Europe, in Canada, in South America, they can really provide the same level of care without overly inflating the cost of care. And it really puts into perspective what we can do and what we should do ultimately as healthcare systems. And something that I've really strived to, bring back to the United States and bring back to healthcare systems and try to make them better. It doesn't always work because, the insurance companies are driving a bus. But it's one of those things that if we really try to gain better perspective, especially being foreign medical graduates coming back into the United States, we have an opportunity to really make a difference if we want to. 3 words: early and often. Start early. Do as much as you can as early on. You have nowhere to go but up. You're on the bottom of the rung coming into medical school as, an itty-bitty baby doctor, and you're soon going to become a full-fledged, physician. Start building your resume now. Obviously study. Sometimes you have to put aside extracurricular activities, sports, things that you'd rather be doing, that you were able to do before in college, to, kind of can make that sacrifice and commit to medical school. But if you do, it'll pay dividends forward, and then you can get on and do those things going forward. Start building your resume very, very quickly. Start making your goal to pass the USMLEs, on the first try and get a good grade. It's not just about passing. And start honing your interview skills. Start developing your interpersonal skills, because it's not only about your interpersonal skills with your patients, but your interpersonal skills with the people who are going to be interviewing you ultimately to get into residency so that you can go on to taking care of patients is of the utmost importance. You have to be eloquent, well-spoken, and understand that you should exude confidence as well, but not overly so. So really starting with those skills very early on is going to make you the most successful ultimately after you graduate, and that'll carry on throughout your career as well. Well, really in the last couple of years is the most connected that I've been to the UAG program. And It's been wonderful. I've had a chance to connect with the faculty. I've had the chance to connect with the dean. I've had the chance to connect with Mr. Lanyo, who I haven't seen in over 20 years. We were joking yesterday that the last time I saw him was in this very building, and wearing an evening gown, being the queen of the medical school at the time. So to be able to reconnect and hopefully have an influence on the program going forward. I've spoken with many students and their families this morning, including, in the cafeteria at the hotel, over the last, 24 hours. And I've encouraged them to, I'm like, contact me through LinkedIn. I want to be an influence in their lives. I want to be a driving force. I want to be a shoulder to cry on. I want to be, inspirational to them. And this has provided me the opportunity really over the last couple of years, and very much more so, during the last couple of days, to really connect more with the program. And I hope that going forward, I can be a driving force and an inspiration, and that person who is helpful to mentor, the oncoming students and the, outgoing graduates.
Thank you so much, Dr. Harrigan.
Thank you very much.